What to expect during mammogram. Hello, my name is Dr. Adora Enyi, and in today's session, we'll be discussing what you should expect when you undergo your mammogram screening. We'll focus on the 5 W's of mammogram screening, which are: what is a mammogram? Where can a mammogram screening be done? Who is eligible to undergo a mammogram screening? And when is the right time to get a mammogram screening? And what you should expect during a mammogram screening. What is a mammogram? Now, a mammogram is an X-ray imaging method used to examine the breast for early signs of abnormalities. It can detect lumps or masses that are too small to be felt and identify changes that may indicate cancer or other breast conditions. Early detection is key to effective treatment. There are 4 common types of breast changes found on the mammogram, and they include calcifications, masses, asymmetries, and distortions. There are 2 types of mammograms that can be done: a screening mammogram or a diagnostic mammogram. Now, a screening mammogram or screening mammograms are routinely performed on women without breast symptoms to detect any signs of breast cancer early. Diagnostic mammograms, on the other hand, are performed when there are specific concerns such as lumps or changes in the breast tissue and provide a detailed image for diagnosis and treatment planning. Where can a mammogram screening be done? Now, mammograms are typically performed at specialized diagnostic centers, hospitals or clinics equipped with a mammography machine. It is important to choose an accredited facility with experienced radiologists to ensure accurate results. Who is eligible to undergo a mammogram screening? Mammograms are recommended for women who are over the age of 40 years, and this is usually part of their routine health checkup. Women with a family history of breast cancer or other risk factors may need to start their screening earlier. Make sure to consult with your doctor to determine the appropriate screening schedule based on your risk factors. When is the right time to get a mammogram screening? Now, women aged 40 and above should have a mammogram every 1 to 2 years. Women at higher risk may need to start earlier and have more frequent screening. Any woman experiencing symptoms such as a lump, pain, or changes in breast shape should get a mammogram regardless of their age. What to expect during a mammogram screening? On the day of your mammogram, you should present to the facility where you booked for your mammogram. Please note that it is important to always go to the same facility every time so that your mammograms can be compared year to year. If you have had mammograms at another facility, please bring those records with you and have them sent to the new facility. Your mammogram should be done at least 1 week after the start of your period. Please ensure that your breasts are not tender or swollen to help reduce discomfort. Also, avoid applying deodorant, powders, lotion, creams, or perfumes under your arms or on your breasts, as these can show up on the X-ray. Wear a skirt or pants to make it easier to undress from the waist up. Discuss any recent changes, problems, and your medical history, such as surgery, hormone use, or family history of breast cancer with your doctor before your scheduled mammogram. During the mammogram, you will undress above the waist and wear a gown provided to you. You'll be asked to stand in front of the machine, and the radiographer will place your breast on the machine. A plastic plate will compress your breast for about 10 to 15 seconds while the X-ray images are being taken. You will then be asked to change your position so that your breast can be compressed from side to side for another X-ray image. The entire process usually takes about 20 minutes, and the actual breast compression lasts only about 10 to 15 seconds for each image to be taken. Now, the images will be taken from different angles, and you might feel some form of discomfort, and for some women, it can be painful. Tell the radiographer if it hurts so that he can adjust the compression to your comfort. 2 views of each breast are taken for a screening mammogram, but more images may be needed for some women. After the exam, you can resume your normal activities immediately, and the radiologist will review your images and send copies of your images along with your report to your doctor. Regular mammograms are crucial for the early detection of breast cancer, as it significantly improves the chances of a successful treatment. If you are due for a mammogram, schedule an appointment today at any accredited facility and make sure you consult with your doctor to ensure that you are following the appropriate screening guidelines. You can book your appointment at Pearl Oncology Specialist Hospital by using the link below. Thank you for watching and stay proactive about your breast health.